Every year, more than 600,000 women have hysterectomies in our country, and now critics are raising the red flag, saying as many as 2/3 of these invasive surgeries to remove the uterus are unnecessary. That's because of newer, less invasive technology. However, a full third of these women do need hysterectomies, and for them, new technology is also making a very big difference. Some of the most advanced technology happening right here on the Suncoast. Dr. Michael Swor is here from Sarasota Memorial Hospital to tell us all about robotic-assisted hysterectomy. Thanks so much for coming in.
Sure, Heidi. Thanks for having me.
What are the conditions when a woman needs a hysterectomy?
Well, there's a lot of particular problems that women can have that can lead to having hysterectomy. Bleeding problems, pain, cancer or precancerous conditions, common condition called endometriosis. Those are probably some of the common ones.
Those are the most common. All right, so what has the standard procedure been for years to remove the uterus?
Well, the traditional procedure for most gynecologic surgeries was open hysterectomy with a big incision, longer recovery, that sort of thing. And in a lot of areas in the country, that's still what's being done.
And it brings risks, doesn't it?
There's general risks with surgery and a longer recovery, risks for bleeding, infection, things like that.
But not anymore. It's all really changing now that you're using a robot to assist you in the surgery. Tell us about this.
Well, about 15, 20 years ago, the minimally invasive procedures started to take a big hold. And more recently, in the last year or two, they've added a new tool, a fantastic new tool called Da Vinci robot surgery. And we're now applying that in women's health, in women's surgery, gynecologic surgery.
And how does it work?
Well, there's tiny little keyhole type incisions that are made, and the surgeon actually works at a console, kind of like a video game. Mm-hmm. The patient's a few feet away, and the hand motions that the surgeon does translate into even more precise movements with the robotic arms actually working on the patient.
And what are the benefits of doing it this incredible way?
Well, you get a better view. It's a 3D camera, 10 times magnification, and the little hand-like instruments actually facilitate or act like wrists and work like little hands inside the body. And we've never had any tools like that before.
And that's better for recovery?
I think it's better for healing, less risk of injury to other organs, less bleeding, less infection. And just in general, we've seen that the patients seem to do better with it.
And you don't always have to remove the entire uterus, right?
No, we have a lot of different alternatives to total hysterectomy. One of them is called the LASH procedure. It stands for laparoscopic supracervical hysterectomy. We actually just remove part of the uterus, and that's become very popular.
All right. Well, Dr. Michael Swor from Sarasota Memorial Hospital, thanks so much for coming in. Appreciate it.
All right.